This is the Emergency Medical Minute.
Okay, so I'd like to talk briefly about fascia iliaca blocks because it's something we're going to be doing more and more. Have you guys seen any done already? These are blocks for hip fractures. Okay, great. It's bupivacaine, yeah. Well, so this particular block, the fascia iliaca, is so the fascia is like the fibrous covering of the muscle belly, and so the fascia iliaca overlies the iliacus muscle. And so the reason we're doing these, so this is kind of in this region right here, is for hip fractures. You can also do them for femur fractures. If you have like a large laceration as well to the thigh, that'd be another reason. And we're generally doing this with bupivacaine, like a large volume of bupivacaine. Often for like a standard adult, it's going to be like 40 to even 60 milliliters, mLs of bupiv. So the few things that you all need to know about these blocks are, one, indications. So pelvic fracture, like proximal femur, so femoral neck, intertroch fractures, proximal femur, or trauma to the thigh where you need to like maybe debride or clean or sew up a large wound. What we're doing is injecting a lot of bupivacaine into this space under the fascia. And so the bupivacaine, the idea is to hit 3 different nerves. The femoral nerves, right just medial to where we're injecting, but there's also 2 other nerves, the obturator and the lateral femoral cutaneous, that also innervate these areas that the bupivacaine is just going to kind of bathe. And the idea is to numb up, to bathe these nerves to give essentially analgesia to these patients' fractures. So for the next like 8 or even 12 hours, they're not going to be able to feel their fracture. And this is really good, obviously, for if you think of the classic person who breaks their intertrochanteric region of their femur. It's like a little old lady, right? Those people don't do great with IV opiates in the hospital. There's a lot of delirium and other outcomes that we want to avoid. And so that's your typical patient, is a little old lady that breaks her proximal femur. As a nurse, you are going to be involved in doing these procedures. There's a couple things you need to know. One, bupivacaine is lethal if you get it in the vessel. And so we are injecting fairly close to the femoral vessels, not into the vessels, and we're using ultrasound to make sure we don't hit the vessel. But you want to make sure you have a cardiac monitor on these patients. So if you are indeed killing the patient, it would be good to know that you're causing an arrhythmia. So you'll see, actually, before you see cardiac toxicity and arrhythmia, you're going to see neurologic changes. So like paresthesias, numbness and tingling, altered mental status, seizure. After that, you start to get the arrhythmia and cardiac death. And so those are the things you need to look for. If it goes in the right place, that's not going to happen, and we're actually not injecting that close to the vessels. That's the whole point of using ultrasound, is to identify the vessels and go pretty far lateral to that. Your jobs are going to be, 1, if there's a panis to be held, to hold it up. 2, to help us inject that medication. So these needles that we got are actually fairly long needles, and then you're going to have some extension tubing away from the end of the needle, and then a pretty large syringe, right? Remember, this is a large volume of bupivacaine, and so oftentimes we'll ask for you all to be the ones injecting. And so we'll be holding the ultrasound probe, and we'll be placing the needle right here at the groin, and then we might say, okay, go ahead and inject a little bit, and you should be able to see a little bit of fluid pocket developing on the ultrasound screen, and say, okay, we're in the right place, go ahead and inject more. And so essentially those are kind of your jobs with this procedure. I think that's about it. Any questions for me?
So say that we happen to kill the patient.
Yes.
What do you like?
That's a really great question.
Is it just standard ACLS, or is there some medication that
yeah,
we could be
there is a medication.
something?
So we are stocking Intralipid in the Pyxis and acute. So this is on this side. It'll be stocked in the Pyxis, and this is something that we're not keeping in the pharmacy because this is like needs to be given immediately. So before, when they're ideally, if you have any symptoms like the neurologic issues, that's when you would give it before the cardiac stuff starts. But Intralipid is thought to be like a lipid sink where it'll bind up all the bupivacaine. You're giving like lipid. You're giving a lipid emulsion. And so that's exactly that. It's a sink to kind of soak up all the bupivacaine intravascularly.
Do you know how to administer it? Is it
How
just
that's
like a quick
dosed?
IV push? Is it an infusion?
No, it's a
Is it-
bolus and then an infusion,
Okay.
and it's not a common medication, so it's going to need to be looked up likely.
Yeah, for sure.
What's that?
Bolus of lipid is so thick.
Yeah, I've never given it. I'll be totally
Hopefully
honest.
you
So,
don't have large
yeah.
Very, very, very large for.
Any other questions?
Really
That's a
thick.
great question. Okay, great. Well, hopefully,
That's
the one other thing to note is these special needles that we're getting in stock. What I'd like to do is create one of those toolboxes, kind of like we have for ultrasound guided IVs. So we'll keep it in the same place. It'll have that, like your tegaderms, probe covers, chloroprep swabs, everything in one spot. So if the doc's looking for it, just look for it at the same place those other toolboxes are.
Yeah, definitely.
What's the name of this again?
Fascia iliaca block for proximal femur fracture, basically like your classic hip fracture.
That's awesome. I think that's such a good alternative to the opiates.
It is, that's the goal. So hopefully you'll see them more and more and encourage your providers to do them.
Yeah, definitely.
Thanks.
Yeah, thank
Okay.
you.